Emily Chun pushed through the glass doors of the Veterans Affairs Hospital, her right leg dragging slightly behind her left. The familiar ache shot up from her ankle to her hip, a daily reminder of the IED that had ended her deployment 3 years ago. She adjusted her worn baseball cap and headed toward the waiting area, hoping today's appointment would finally clear her for the job interview next week. Near the reception desk, 2 men in crisp Navy uniforms stood beside a recruitment banner. Staff Sergeant Rodriguez spotted her immediately, his eyes tracking her uneven gait. He nudged his partner, Petty Officer Williams, and spoke just loud enough for her to hear. "Check out the limper over there." Rodriguez's voice carried that particular brand of military mockery she knew too well. "Bet she's here for another disability check increase." Williams chuckled and shook his head. "These broken warriors keep showing up expecting handouts. Look at her trying to walk like she's still got it." Emily kept her expression neutral and continued toward the seating area. She had learned long ago that responding to ignorance only fed it. Instead, she found an empty chair near the window and sat down carefully, keeping her injured leg straight. Rodriguez wasn't finished. He stepped closer, his recruitment materials rustling in his hands. "You know what really gets me? These people think they understand what real service looks like. One little injury and they're done. Meanwhile, we're out here every day maintaining the standard. The SEALs think they're recruiting today," Williams added, gesturing toward their banner. "Can you imagine her trying to make it through selection? She'd tap out during the first fitness test. Have you ever witnessed someone being judged unfairly? Drop your state in the comments, and let's see where our community stands on supporting our veterans." Emily pulled out her phone and scrolled through messages, appearing absorbed while listening to every word. Dr. Sarah Mitchell, the hospital administrator, emerged from behind the front desk with a clipboard. She glanced between Emily and the 2 recruiters, sensing tension but unsure of its source. Rodriguez straightened his uniform and addressed Dr. Mitchell directly. "Ma'am, we're here today talking to qualified candidates about opportunities in naval special warfare. We're looking for people who can meet our physical and mental standards." His emphasis on the word qualified wasn't lost on anyone in the waiting room. Emily continued staring at her phone, but her jaw tightened almost imperceptibly. "That's wonderful," Dr. Mitchell replied, though her tone suggested she was already picking up on the recruiter's attitude. "We have many veterans who come through here with incredible backgrounds and experience." Williams glanced meaningfully at Emily. "Sure, but we need people who can still perform when it counts. Not everyone who wore the uniform was cut out for elite operations." Emily finally looked up from her phone, meeting Williams' gaze directly. For just a moment, something flickered in her eyes that made him shift uncomfortably. Then she returned to her screen without saying a word. Rodriguez sensed his partner's hesitation and pressed forward. "The thing is, Doc, we can't lower our standards just because someone got hurt. The teams need operators who are 100% mission capable. No exceptions." The waiting room had grown quiet except for the soft hum of fluorescent lights and the distant sound of medical equipment. Other patients pretended to read magazines while stealing glances at the unfolding scene. Dr. Mitchell's expression grew cooler as she processed the recruiter's words. She had worked with veterans for 15 years and recognized condescension when she heard it. Her clipboard tapped against her leg as she considered her response. "I think you might be surprised by the caliber of people we serve here," she said carefully. "Many of our patients have backgrounds that would impress even your standards." Rodriguez laughed, the sound echoing off the sterile walls. "With all due respect, ma'am, we know what we're looking for. It takes a special kind of person to earn a trident. Not everyone who's served has what it takes for special operations." Emily shifted in her chair, her phone now forgotten in her lap. A middle-aged man in a wheelchair nearby looked up from his newspaper, clearly irritated by the conversation. An elderly woman with a Purple Heart pin on her jacket frowned disapprovingly at the recruiters. Williams noticed the growing tension and decided to double down. "Look around this place. Half these people are here because they couldn't hack it when things got tough. The real warriors don't end up broken and begging for help. The words hung in the air like a physical presence. Emily's knuckles whitened as her grip tightened on her phone, but she remained silent. Her breathing stayed controlled, measured, the way she had been trained years ago in situations requiring extreme composure. Dr. Mitchell stepped forward, her professional demeanor barely containing her anger. "Gentlemen, I think you should reconsider your approach. These are American heroes who sacrifice for their country." Rodriguez held up his hands in mock surrender. "Hey, we're not trying to offend anyone. We're just being realistic about what elite units require. Physical limitations are physical limitations. The enemy doesn't care about your feelings or your injuries." Emily finally stood up, testing her weight on her bad leg. The movement was deliberate, controlled, despite the obvious discomfort. She walked slowly toward the reception desk, passing directly by the two recruiters. Rodriguez watched her approach with barely concealed amusement. "Need some help getting around, sweetheart?" Williams called out as she passed. "The VA probably has wheelchairs available if walking gets too difficult." Emily stopped just past them, close enough that they could see the faded scar running along her left temple, partially hidden by her cap. She turned slightly, just enough to make eye contact with Williams. "I managed just fine, thank you," she said quietly. Her voice carried a quality that made both men pause, something that suggested depths they hadn't recognized. Rodriguez recovered quickly, mistaking her composure for weakness. That's the spirit. Positive attitude goes a long way in recovery. Maybe someday you'll be able to walk normally again. The waiting room had gone completely silent now. Even the receptionist behind the desk had stopped typing to listen. Dr. Mitchell watched Emily carefully, noting something in her posture that didn't match the recruiter's assumptions. Emily reached the reception desk and spoke quietly to the clerk about her appointment. Her movements were economical, precise, lacking any wasted motion despite her injury. Rodriguez and Williams continued their conversation, apparently satisfied that they had made their point. "See what I mean?" Rodriguez said to Dr. Mitchell. "Nice lady, probably served honorably in some support role. But there's a difference between serving and being an operator. Elite units can't afford to carry dead weight." Williams nodded sagely. "The teams are about brotherhood, but they're also about capability. You need people who can carry their own load, and then some. Someone who can't even walk properly isn't going to make it through the pipeline." Emily finished at the reception desk and began walking back toward her seat. This time, her limp seemed more pronounced, whether from fatigue or simply the stress of standing. Rodriguez watched her progress with obvious pity. "That's exactly what I'm talking about," he said, not bothering to lower his voice. "Good intentions don't overcome physical reality. The battlefield doesn't care about your inspirational story." As Emily settled back in her chair, Dr. Mitchell's pager buzzed urgently. She glanced at it, then looked around the waiting room with new concern. The hospital's intercom crackled to life, requesting all available medical personnel to the emergency department. Dr. Mitchell excused herself and hurried toward the emergency department, leaving the recruiters alone with the waiting patients. Rodriguez and Williams seemed pleased with themselves, apparently convinced they had made their point about military standards and capability. The emergency department doors burst open as medical staff rushed past the waiting area. Through the glass partition, Emily could see doctors and nurses moving with urgent purpose. Her training kicked in automatically, her eyes tracking the controlled chaos with professional interest. Rodriguez noticed her attention and smirked. "Looks like some real action happening over there. Too bad, not everyone can handle that kind of pressure anymore." Williams gestured toward the emergency activity. "That's what separates the operators from everyone else. When things get critical, you need people who can perform under stress. No room for the walking wounded." Emily's jaw tightened slightly, but she kept watching the medical team through the glass. Her posture had shifted almost imperceptibly from that of a patient waiting for an appointment to something more alert, more focused. An elderly veteran in the corner shook his head in disgust. "You boys don't know what you're talking about," he muttered, loud enough for the recruiters to hear. Rodriguez turned toward him with barely concealed irritation. "Excuse me, sir?" The old man folded his newspaper deliberately. "I said you don't know what you're talking about. I've seen plenty of warriors in my time, and they don't all look the same." Williams stepped closer to the elderly veteran. "With respect, sir, we work with special operations personnel every day. We know what elite performance looks like." The old man's eyes flashed. "Do you now? And what makes you think that young lady over there doesn't have what it takes?" Emily glanced over at the conversation, but said nothing. Her attention kept drifting back to the emergency department, where the activity seemed to be intensifying. More staff members were being called in, and she could hear the distant sound of monitors beeping urgently. Rodriguez laughed dismissively. "Look at her. She can barely walk across the room without struggling. Special operations requires peak physical condition, not good intentions." The elderly veteran stood up slowly, his own movements careful but determined. "Son, I've been coming to this hospital for 20 years. I met a lot of people here who would surprise you." Meanwhile, the emergency department doors opened again, and Dr. Mitchell appeared, scanning the waiting room urgently. Her face was flushed with stress, and she moved with the quick efficiency of someone dealing with a crisis. Williams noticed Dr. Mitchell's return and called out to her. "Everything okay over there, Doc? Looks like you've got your hands full." Dr. Mitchell paused, clearly distracted by whatever was happening in the emergency department. "We have a situation. Multiple casualties from a vehicle accident, and we're short-staffed today." Rodriguez straightened, sensing an opportunity. "Well, if you need any help with crowd control or security, we're trained for crisis situations." "That's kind of you," Dr. Mitchell replied absently, "but we need medical personnel right now. The EMTs are bringing in 3 more patients, and one of them is critical." Emily's head snapped up at the word critical. Her entire demeanor changed in that instant, becoming more focused and alert. She stood up from her chair, testing her weight on her injured leg. "How critical?" Emily asked quietly, her voice carrying a new quality that made everyone in the waiting room turn toward her. Dr. Mitchell looked at her with surprise. The lead EMT said possible cardiac arrest. 42-year-old male, construction worker. They've been working on him for 15 minutes. Emily took a step toward Dr. Mitchell, her limp still noticeable, but somehow less significant now. "Do you have enough hands in there?" The question was simple, but something in Emily's tone made Dr. Mitchell pause and really look at her for the first time. There was an authority in her voice that didn't match the recruiter's assessment of her capabilities. Rodriguez interrupted before Dr. Mitchell could respond. "Doc, I don't think sending patients into an emergency situation is the best idea, especially someone who's already dealing with mobility issues." Emily turned toward Rodriguez, and for the first time since entering the hospital, she looked directly at him with full attention. The intensity of her gaze made him step back slightly. The look Emily gave Rodriguez carried weight that made him unconsciously straighten his posture. It was the kind of gaze that suggested experience with life-and-death decisions, though he couldn't quite place why it unsettled him. Dr. Mitchell found herself studying Emily more carefully. There was something about the way she had asked about the cardiac arrest patient, a clinical precision that seemed oddly familiar. "We're managing," Dr. Mitchell said slowly, "but we could use additional qualified personnel." "Are you medical?" Emily nodded once. "I have training." Williams laughed outright. "Training? What kind of training?" "First aid certification doesn't count when someone's having a heart attack." The elderly veteran who had spoken up earlier moved closer to the group. He was watching Emily with growing interest, as if recognizing something the recruiters were missing entirely. Emily ignored Williams completely and focused on Dr. Mitchell. "How many compressions per minute are they maintaining? Are they getting adequate chest rise with ventilation?" Dr. Mitchell blinked in surprise. The questions were specific, professional, exactly what she would expect from someone with advanced medical training. 30 compressions, 2 breaths. But they're having trouble with airway management. Rodriguez stepped between Emily and Dr. Mitchell. "Hold on a second. You're not seriously considering letting a patient help with emergency medical care, are you?" "She can barely walk." Emily's expression didn't change, but something in her posture suggested Rodriguez had just made a significant error in judgment. The elderly veteran noticed it and smiled slightly. Dr. Mitchell was torn between protocol and the growing sense that Emily might actually be qualified to help. What level of medical training do you have? Advanced cardiac life support, trauma surgery, field medicine, Emily replied matter-of-factly. Her voice carried the quiet confidence of someone stating facts rather than boasting. Williams shook his head in disbelief. Come on, where exactly did you get trauma surgery training? Community college? Emily turned toward Williams with the same intense focus she had given Rodriguez. Her answer was simple and delivered without emotion. Kandahar Province. Fallujah. Ramadi. The waiting room went completely silent. Even Rodriguez stopped smiling. Those weren't places where people got casual medical training. Those were combat zones where medics learned to save lives under fire. Dr. Mitchell felt pieces clicking together in her mind. The way Emily moved despite her injury. The clinical questions. The calm authority in her voice. Navy corpsman? Emily shook her head slightly. SEAL medic. The words hit the waiting room like a physical blow. Rodriguez's face went pale. Williams stepped backward as if he had been pushed. The elderly veteran's smile widened into a full grin. Dr. Mitchell's professional demeanor shifted immediately. She had worked with enough military medical personnel to recognize the real thing when she heard it. How long? 8 years active duty. 3 deployments. Emily's responses remained crisp and factual. Rodriguez found his voice, but it came out as barely more than a whisper. You're telling us you're a Navy SEAL? Emily's eyes moved from Rodriguez to Williams and back again. She didn't answer the question directly, but her silence was somehow more powerful than any words could have been. The emergency department doors burst open again, and a nurse rushed out looking frantically around the waiting area. Dr. Mitchell, we need you now. We're losing him. Dr. Mitchell looked between Emily and the emergency department. Protocol dictated that she couldn't allow an unverified civilian into a medical emergency. But her instincts told her that Emily might be exactly what they needed. Can you prove your credentials? Dr. Mitchell asked quickly. Emily reached into her jacket and pulled out a military ID card, handing it to Dr. Mitchell. The doctor glanced at it, her eyes widening as she read the designation and clearance level. Hospital Corpsman Advanced, Special Warfare Qualified, Dr. Mitchell read aloud. Current DoD Medical Certification. Rodriguez stared at the ID card as if it might disappear. That's not possible. She can't even walk properly. Emily took the ID back from Dr. Mitchell and looked directly at Rodriguez. The IED that damaged my leg also killed 3 insurgents who were about to overrun our position. I stayed conscious long enough to stabilize 2 wounded teammates before the medevac arrived. Williams opened his mouth to respond, but no words came out. The confident mockery from earlier had evaporated completely, replaced by a growing understanding of how badly they had misjudged the situation. The tension in the waiting room had shifted palpably after Emily's quiet revelation about her medical credentials. Rodriguez and Williams exchanged uncertain glances, their earlier confidence beginning to crack as they processed what they had just heard. Dr. Mitchell glanced between Emily and the emergency department, where the crisis was clearly intensifying. The sound of urgent voices and rushing footsteps filtered through the doors, creating an atmosphere of controlled urgency that Emily recognized immediately. Emily stood up from her chair, her movements deliberate despite her injury. The clinical questions she had asked about compressions and airway management had revealed a level of medical knowledge that didn't match the recruiter's assumptions about her capabilities. Dr. Mitchell made a quick decision. Come with me, she said to Emily. If you're qualified, we could use the help. Rodriguez stepped forward, his voice carrying less certainty than before. Ma'am, are you sure about bringing a patient into an active medical emergency? Emily turned toward Rodriguez, and for the first time that morning, she looked directly at him with her full attention. The intensity of her gaze made him step back slightly, as if he was seeing her clearly for the first time. I'm not a patient right now, Emily said quietly. I'm a medic. The distinction was subtle, but profound. Emily had shifted from someone seeking medical care to someone prepared to provide it, and everyone in the waiting room sensed the change in her demeanor. Williams found his voice, but it came out less steady than before. "You're really qualified for emergency medicine?" Emily's response was matter-of-fact. 8 years treating trauma in combat zones. Advanced life support, surgical assist, field medicine under fire. Each credential she listed hit the recruiters like a physical blow. These weren't civilian certifications, but military specialties that required extensive training and real-world application under the most challenging conditions imaginable. Dr. Mitchell was already moving toward the emergency department. "We need to go now," she said to Emily. "Every minute matters." Emily followed Dr. Mitchell, her limp still evident, but somehow less significant now. Her posture had changed, becoming more purposeful and alert as her professional training took precedence over her physical limitations. The elderly veteran who had spoken up earlier watched Emily leave with obvious satisfaction. He turned to Rodriguez and Williams with a knowing expression that suggested he had understood something about Emily that they had missed. "You boys might want to pay attention to what happens next," the old man said. "You're about to get an education in what real capability looks like." Rodriguez stared at the emergency department doors, struggling to reconcile Emily's obvious injury with her claimed medical expertise. Everything about the morning had been turned upside down by her quiet revelations. Williams sat down heavily in his chair. "How do we miss this? She never said anything about being qualified for anything." The elderly veteran's laugh was dry but not unkind. "Son, capable people don't usually announce their capabilities to folks who are busy judging them. They just get on with the work." Through the glass partition, they could see Emily entering the emergency department with Dr. Mitchell. Even from a distance, her transformation was visible as she moved from the role of patient to that of medical professional. Rodriguez looked at his recruitment materials with growing uncertainty. Their training had emphasized physical fitness assessments and standardized interviews, but nothing had prepared them for someone whose capabilities were hidden beneath apparent limitations. The waiting room had grown quiet except for the distant sounds of the medical emergency. Other patients were stealing glances at the recruiters, clearly aware that something significant was unfolding. Williams checked his watch nervously. What if she's really as qualified as she claims? What if we've been completely wrong about everything? The question hung in the air like a challenge to everything they thought they knew about identifying military capability and potential. Their assumptions about Emily had been based entirely on her visible injury, ignoring any other indicators of her background or abilities. Dr. Mitchell made her decision. "Follow me," she said to Emily, then turned toward the emergency department without waiting for a response. Emily moved immediately, her limp still evident but her pace determined. Rodriguez and Williams stood frozen, watching her walk away with a composure that contradicted everything they had assumed about her. The elderly veteran chuckled and shook his head. "Boys, you just learned a valuable lesson about judging books by their covers." Rodriguez finally found his voice. "This can't be happening. SEALs don't end up broken in VA waiting rooms." The old man's expression grew serious. "Son, every warrior carries scars. The visible ones aren't always the worst." Meanwhile, Emily followed Dr. Mitchell through the emergency department doors. The controlled chaos hit her immediately, familiar in its intensity. 3 trauma bays were occupied, monitors beeping urgently, medical staff moving with practiced efficiency. Dr. Mitchell pointed toward the central trauma bay. "That's our cardiac arrest. 42-year-old male, construction worker. They've been working on him for 22 minutes. Emily approached the trauma bay, her training automatically cataloging everything she observed. The patient was intubated, chest compressions ongoing, multiple 4 lines established. The team was good, but she could see fatigue setting in. "Who's running the code?" Emily asked quietly. "Dr. Patel, the emergency physician," Dr. Mitchell replied. "He's been here for 18 hours. Emily watched Dr. Patel directing the resuscitation efforts. His movements were still precise, but she recognized the subtle signs of exhaustion that could affect decision-making in critical moments. The patient's monitor showed a rhythm that made Emily step closer. She studied the waveform carefully, noting patterns that others might miss after working a prolonged code. "What's his downtime?" Emily asked one of the nurses. "Estimated 15 minutes before EMS arrived," the nurse replied, without looking up from her compressions. "They got pulses back twice in the field, but lost them again." Emily nodded, processing the information. In the waiting room, Rodriguez and Williams remained stunned by the revelation. The recruitment banner behind them seemed to mock their earlier confidence. "I don't understand," Williams said to the elderly veteran. "How do we not know?" The old man settled back into his chair. "Because you were looking for what you expected to see, not what was actually there." Rodriguez stared at the emergency department doors. "But she's injured, disabled. That's not what SEALs look like." The veteran's voice carried decades of experience. SEALs look like whatever they need to look like to complete the mission. That's what makes them special. In a trauma bay, Emily continued observing the resuscitation efforts. The team was following proper protocols, but she noticed subtle inefficiencies that experience had taught her to recognize. Dr. Patel called for another round of epinephrine, his voice showing strain. The patient's rhythm remained unchanged, flatlined except for the mechanical artifact from chest compressions. Emily stepped slightly closer, still maintaining appropriate boundaries, but positioning herself where she could intervene if needed. Her medical instincts were fully engaged now, years of training and experience taking precedence over everything else. Dr. Mitchell watched Emily's reaction to the code. She had worked with enough military medics to recognize the look of someone mentally running through protocols and alternatives. The compressions continued, but Emily could see the team's energy flagging. 25 minutes was approaching the point where many would consider calling the code, especially given the prolonged downtime. She noticed something about the patient's positioning that the team had missed, a subtle detail that could affect the effectiveness of their efforts. Something she had learned in field conditions where every advantage mattered. Emily took another step forward, close enough now that Dr. Patel noticed her presence. He glanced up briefly, seeing an unfamiliar face in scrubs that Dr. Mitchell had hastily provided. "Are you the additional physician Dr. Mitchell called?" Dr. Patel asked, hope evident in his voice. Emily looked to Dr. Mitchell, who nodded slightly. "Special warfare medic," she said simply. Dr. Patel's expression shifted to one of respect, mixed with relief. The reputation of military medics in trauma situations was well established in emergency medicine circles. "What do you see?" Dr. Patel asked, stepping back slightly to give Emily room to assess the situation. Emily moved to the patient's side, her limp forgotten as her professional training took complete control. Emily's eyes moved systematically across the patient, taking in details that 25 minutes of resuscitation efforts had made difficult for the exhausted team to notice. Her assessment was methodical, drawing on years of experience treating trauma in the most challenging conditions imaginable. The patient's skin had a particular pallor that suggested something beyond a cardiac arrest. Emily noticed slight asymmetry in chest rise during ventilation that others had missed in the intensity of the moment. "How much fluid has he received?" Emily asked, her voice carrying quiet authority. Dr. Patel checked the chart quickly. 2 liters normal saline, plus whatever the paramedics gave him in the field. Emily nodded, processing the information while continuing her visual assessment. She moved around the table with practiced efficiency, her injured leg no longer seeming to hinder her movement. The nurse performing chest compressions was showing signs of fatigue, her rhythm becoming slightly irregular. Emily stepped beside her, ready to take over if needed. "Any history of trauma today?" Emily asked, studying the patient's positioning on the gurney. "Construction accident," Dr. Patel replied. "Fell from scaffolding about 3 hours before the arrest. He was conscious and alert initially, complained of back pain." Emily's expression sharpened. The pieces were beginning to form a pattern that her combat medical experience had taught her to recognize. Falls, delayed cardiac events, and fluid resuscitation could indicate complications the team might not have considered. She moved to the patient's side and placed her hands on his chest, feeling for landmarks that might reveal hidden injuries. Her touch was confident and precise, drawing on muscle memory developed under fire. "Did anyone get a fast exam?" Emily asked, referring to the focused ultrasound assessment that could reveal internal bleeding. Dr. Patel shook his head. "We went straight to ACLS protocols when he arrested. The fall seemed minor initially." Emily looked at Dr. Mitchell, who had remained nearby, observing the interaction. "In the field, we learned that delayed presentation often means internal bleeding, especially with fall mechanisms." The implication was clear. The patient might not just be suffering from a primary cardiac event. There could be trauma-related complications that were complicating the resuscitation efforts. Dr. Patel's fatigue-clouded thinking began to clear as Emily's assessment provided a new framework for understanding the case. "You think he's bleeding internally?" Emily nodded toward the patient's abdomen. "Distension is subtle but present. Blood pressure response to fluid has been poor, and the mechanism fits." The team exchanged glances as Emily's observations reframed their approach to the case. What had seemed like a straightforward cardiac arrest was potentially something much more complex. Meanwhile, in the waiting room, Rodriguez and Williams remained in stunned silence. The elderly veteran had returned to his newspaper, occasionally glancing at them with amusement. "She's actually in there helping," Williams said quietly, as if he couldn't quite believe his own words. Rodriguez stared at the emergency department doors. "We called her broken. We said she couldn't handle pressure." The old veteran looked up from his paper. "Pressure is exactly what people like her were trained to handle. The question is whether you boys learned anything from this." Back in the trauma bay, Emily was explaining her assessment to Dr. Patel while the resuscitation continued. Her voice remained calm and professional, but there was an underlying urgency that came from understanding the larger picture. If he's bleeding into his abdomen, the cardiac arrest could be secondary to hypovolemic shock, Emily explained. Standard ACLS won't address the underlying problem. Dr. Patel nodded, his respect for Emily's clinical insight evident. "What would you recommend?" Emily's response was immediate and confident. "Ultrasound to confirm bleeding, type and cross for blood products, and surgical consultation. We need to treat the cause, not just the symptoms." The nurse performing compressions looked up hopefully. "Should I continue CPR?" Emily checked the monitor again, noting the rhythm and the patient's response to ongoing efforts. "Continue compressions, but we need to move fast on the workup. Time is critical." Dr. Patel began issuing orders based on Emily's recommendations, his energy renewed by having a clear diagnostic pathway. The team responded immediately, their efficiency improving as they worked toward specific goals rather than simply following protocols. The ultrasound machine arrived within minutes, wheeled in by a technician who looked surprised to see the level of activity around what had been considered a routine cardiac arrest case. Emily positioned herself where she could observe the screen while Dr. Patel prepared to perform the fast exam. Dr. Patel placed the ultrasound probe on the patient's abdomen, starting with the standard views that would reveal fluid in the peritoneal cavity. Emily watched the screen intently, her experienced eye immediately recognizing what appeared on the monitor. "There," Emily said quietly, pointing to a dark area on the screen. "Free fluid in Morrison's pouch." Dr. Patel's expression grew grave as he moved the probe to check additional views. The subphrenic space showed similar findings. Blood in the abdomen, confirming Emily's suspicion that the cardiac arrest was secondary to internal bleeding. The nurse performing compressions looked up hopefully. "Does this mean we have a chance?" Emily nodded, but her expression remained focused. "If we can get him to surgery fast enough. The question is how much blood he's lost and whether we can replace it quickly enough." Dr. Patel was already reaching for the phone to call the surgical team while continuing to direct the resuscitation. Emily took over chest compressions from the fatigued nurse, her rhythm immediately becoming more consistent and effective. The difference was immediately apparent to everyone in the trauma bay. Emily's compressions were textbook perfect, maintaining optimal depth and rate while allowing complete chest recoil between compressions. Years of training and real-world application showed in every movement. Dr. Mitchell watched from nearby, increasingly impressed by Emily's seamless integration into the medical team. It was clear that she wasn't just qualified to help, she was elevating the entire resuscitation effort. Blood bank is sending up on negative, Dr. Patel announced after hanging up the phone. Surgery is on their way down to evaluate. Emily continued compressions while speaking to the team. We need to get his pressure up before they take him upstairs. How much blood can we push before surgery arrives? The question demonstrated Emily's understanding of the delicate balance in trauma resuscitation. Too little fluid replacement would leave the patient hypotensive, but too much could dilute clotting factors and worsen bleeding. Dr. Patel checked his watch. Surgeon should be here in 5 minutes. Blood products in 3. Emily nodded, adjusting her compression technique slightly to optimize circulation. In the field, we learned that every minute counts with hemorrhagic shock. The window for intervention closes fast. Back in the waiting room, Rodriguez had moved closer to the emergency department doors, trying to catch glimpses of what was happening inside. Williams remained seated, but his earlier confidence had completely evaporated. The elderly veteran folded his newspaper and stood up slowly. You boys might want to think about apologizing when she comes back out. Rodriguez turned toward him. Apologizing? The old man's expression was serious. That woman in there is saving someone's life right now. While you were judging her fitness for service, she was already serving. Williams found his voice. We didn't know. She didn't say anything about being a SEAL. The veteran's laugh was dry. Why would she? Did you introduce yourselves by listing your qualifications? Or did you just assume you were the most capable people in the room? The blood products arrived in the trauma bay, and Emily helped coordinate their administration while maintaining compressions. Her movements were efficient and confident, showing no signs of the physical limitations that had been so obvious in the waiting room. The patient's monitor began showing subtle changes as his blood volume was restored. The rhythm remained abnormal, but there were signs that circulation was improving. Emily felt for a pulse during a brief pause in compressions. Weak but present, she announced. His pressure is coming up. Dr. Patel smiled for the first time since the code began. The surgical team pushed through the trauma bay doors just as Emily was noting the improvement in the patient's condition. The lead surgeon, Dr. Martinez, quickly assessed the situation while Emily continued coordinating care. She briefed him efficiently on their findings and interventions, her report concise and comprehensive. Dr. Martinez nodded approvingly. Excellent workup. How long has he been down total? 32 minutes, but we've had pulses back for the last 8, Emily replied. Ultrasound shows significant hemoperitoneum, likely splenic injury from the fall. The surgeon's respect for Emily's assessment was evident. We need to get him upstairs immediately. Can you help us transfer? Emily looked down at her injured leg, then back at the surgical team. Without hesitation, she positioned herself to help move the patient to the transport gurney, her limp completely forgotten in the urgency of the moment. Emily helped transfer the patient to the surgical gurney with fluid efficiency that made her injury seem irrelevant. Her movements coordinated perfectly with the surgical team as they prepared for immediate transport to the operating room. As the patient was wheeled away, Dr. Martinez turned back to Emily with obvious respect. That was exceptional diagnostic work. Where did you train? Naval Medical Center, Portsmouth, Emily replied. Special warfare medicine. Dr. Martinez's eyebrows rose. That explains the clinical acuity. Field medicine teaches you to see the big picture fast. Emily nodded, beginning to feel the adrenaline wearing off as the immediate crisis passed. Her limp returned gradually as her body reminded her of its limitations, but the transformation that had just occurred was unmistakable. Dr. Patel approached Emily as she helped clean up the trauma bay. I've been doing emergency medicine for 12 years, and that was some of the best clinical reasoning I've seen. You probably saved his life. Emily's response was characteristically understated. Team effort. You had all the right protocols in place. But Dr. Patel shook his head. We were treating symptoms. You identified the underlying pathology. There's a difference. Dr. Mitchell had watched the entire resuscitation with growing amazement. She had worked with military medics before, but Emily's combination of technical skill and leadership under pressure was extraordinary. As the trauma bay returned to normal, Emily began to show signs of fatigue. The sustained physical effort combined with her existing injury was taking its toll, but her professional demeanor remained intact. You should sit down, Dr. Mitchell suggested. You've been on your feet for 40 minutes. Emily accepted the suggestion gratefully, lowering herself carefully into a nearby chair. For the first time since the emergency began, her injury was clearly visible again as she adjusted her position to accommodate her damaged leg. Dr. Patel noticed her discomfort, and his expression grew concerned. How long ago was your injury? 3 years, Emily replied. IED in Helmand Province. Took out most of my right ankle and did some nerve damage. Dr. Patel's respect deepened further. And you're still practicing medicine? Emily's smile was slight but genuine. Different kind of practice now. I work as a civilian paramedic. Less running, more thinking. The irony of her statement wasn't lost on anyone who had just witnessed her performance in the trauma bay. Her physical limitations had been completely overshadowed by her medical expertise and leadership. Back in the waiting room, Rodriguez and Williams had been joined by several other patients who had witnessed the earlier confrontation. Word was spreading about what had just happened in the emergency department. The elderly veteran was holding court, explaining to anyone who would listen about the lesson in judgment that had just unfolded. His voice carried satisfaction mixed with disappointment at the recruiter's behavior. Those boys learned today that warriors come in all shapes and sizes, he was saying. That young lady just proved more about military capability in 40 minutes than most people prove in a lifetime. Rodriguez remained near the emergency department doors, struggling with the implications of what had occurred. Everything he thought he knew about military fitness and capability had been challenged by Emily's performance. Williams sat in stunned silence, replaying the morning's events and trying to understand how they had gotten everything so wrong. Their recruitment training had emphasized physical standards and appearance, but nothing had prepared them for this situation. In the emergency department, Emily was answering questions from the medical staff who had gathered to discuss the case. Her explanations were clear and educational, turning the successful resuscitation into a learning opportunity for the entire team. The diagnostic approach you used, Dr. Patel, was saying, looking at the other residents and nurses. Remember this case when you're dealing with trauma patients. Mechanism of injury, timing of symptoms, and response to treatment all matter. Emily nodded. In the field, we learn to trust our instincts when something doesn't fit the expected pattern. This patient's presentation had elements that suggested trauma, not primary cardiac disease. Dr. Mitchell listened to Emily's teaching with growing admiration. Not only had she helped save a life, but she was now sharing her knowledge with the next generation of medical providers. As the discussion continued, Emily's pager buzzed. She glanced at it and smiled slightly. That's probably my supervisor wondering why I'm late for my shift. You're working today? Dr. Patel asked with surprise. Emily stood up carefully, testing her weight on her injured leg. Civilian EMS. We cover 3 counties, and Tuesday is usually busy. The casual way she mentioned returning to work after what had just transpired demonstrated a level of professional dedication that impressed everyone present. Emily prepared to leave the emergency department, gathering the personal items she had set aside during the resuscitation. Dr. Mitchell walked alongside her, clearly reluctant to see her go. Before you leave, Dr. Mitchell said, I have to ask, why didn't you mention your background when those recruiters were making their comments? Emily paused, considering the question. She had heard similar ignorance before and learned that arguing rarely changed minds, because proving them wrong was more effective than telling them they were wrong. The wisdom in her response struck Dr. Mitchell immediately. Actions had indeed spoken louder than any words could have. Emily's quiet dignity in the face of mockery had been far more powerful than any defensive response. As they approached the waiting room, Emily could see Rodriguez and Williams still there, though their earlier confidence had been replaced by obvious discomfort. The elderly veteran caught sight of her and smiled broadly. "There she is," the old man announced loudly enough for everyone to hear. The woman who just saved a man's life while two Navy recruiters sat in chairs talking about capability. Emily felt every eye in the waiting room turned toward her. Rodriguez and Williams looked up with expressions that mixed shame, disbelief, and dawning respect. The transformation in their demeanor was complete and visible. Rodriguez stood up slowly, his earlier arrogance replaced by something approaching humility. "Ma'am, I owe you an apology. We were completely out of line." Emily stopped near the recruitment banner that had been the backdrop for their morning confrontation. She looked at Rodriguez with the same calm expression she had maintained throughout the entire ordeal. "No apology necessary," Emily said quietly. "You made assumptions based on limited information. It happens." But Williams shook his head, clearly struggling with the magnitude of their error. "We called you broken. We said you couldn't handle pressure, and you just spent the last hour saving someone's life." Emily's expression softened slightly. Everyone carries invisible wounds. Some physical, some not. The measure of a warrior isn't the absence of scars. Dr. Mitchell watched the interaction with fascination. Emily's grace under pressure extended beyond medical emergencies to personal confrontations as well. Rodriguez looked down at his recruitment materials, then back at Emily. "How do we explain this to our command? We're supposed to be identifying qualified candidates, and we completely missed a decorated seal right in front of us." Emily's response was matter-of-fact. "You saw someone with a visible disability and made assumptions about capability. Maybe the lesson is that merit comes in many forms." The elderly veteran approached the group, his satisfaction evident. "Young lady, that was a masterclass in how to handle ignorance with dignity." Emily acknowledged his comment with a nod. "Thank you for speaking up earlier. That meant something." The old man's eyes twinkled. 40 years in the Army teaches you to recognize the real deal when you see it. These boys just needed their education completed. Williams found the courage to ask the question that had been bothering him. "How are you still serving? I mean, with your injury and everything." Emily's answer revealed another layer of her character. "Service doesn't end when you leave active duty. I'm a civilian paramedic now. Different uniform, same mission." Dr. Mitchell realized that Emily's service had never actually stopped. She had simply transitioned from military medicine to civilian emergency services, continuing to save lives in a different capacity. Rodriguez looked at his recruitment banner with new understanding. "We've been focusing on the wrong things, haven't we? Physical perfection instead of character and competence." Emily followed his gaze to the banner. "The best operators I knew weren't necessarily the fastest or strongest. They were the ones who could think clearly under pressure and put the mission above their own comfort." Her words carried the weight of real experience, not theoretical knowledge. She had worked alongside the elite operators that Rodriguez and Williams aspired to recruit. Dr. Mitchell's pager buzzed, reminding her of other responsibilities. "But before I go," she said to Emily, "would you consider doing some training with our staff? Your approach to trauma assessment could benefit our entire team." Emily smiled. "I'd be honored to help." The offer represented more than just professional collaboration. It was recognition of Emily's expertise and an invitation to continue serving in yet another capacity. Rodriguez and Williams exchanged glances, both recognizing that they had witnessed something that would fundamentally change their approach to recruitment and their understanding of what military capability actually looked like. The waiting room had returned to its normal quiet hum, but the atmosphere had been permanently altered by the morning's events and the lessons that had been learned by everyone present. As Emily prepared to leave for her shift, Dr. Martinez appeared from the elevator with an update on the patient. His expression was relieved and grateful as he approached the group. "The surgery went perfectly," Dr. Martinez announced. "Splenic laceration, just as you diagnosed. We were able to repair it without complications. He's stable and should make a full recovery." Emily's quiet smile showed genuine satisfaction. The patient's successful outcome validated not just her diagnostic skills, but the entire team's coordinated response to the emergency. Dr. Martinez turned specifically to Emily. "Your early identification of the internal bleeding made all the difference. In trauma surgery, timing is everything, and you bought us the time we needed." Rodriguez and Williams listened to this exchange with growing comprehension of just how significant Emily's contribution had been. A man's life had hung in the balance, and her expertise had been the critical factor in saving him. The elderly veteran stepped forward, extending his hand to Emily. "Harold Morrison, Army Airborne, retired. It's been an honor watching you work today." Emily shook his hand with respect. "Thank you for your service, Mr. Morrison. And thank you for speaking up earlier." Harold's expression grew serious. "I've seen too many good people judged by their limitations instead of their capabilities. Today was a reminder of why that's dangerous." Dr. Mitchell approached with a clipboard and what appeared to be official forms. "Emily, I've taken the liberty of starting the paperwork for guest privileges here at the hospital. Your skills would be valuable to our emergency department." Emily looked surprised by the offer. "I appreciate that, but I'm committed to my EMS service." Dr. Mitchell smiled. "This would be in addition to your regular duties. Consultation basis for complex trauma cases. We could use someone with your field experience." The offer represented significant recognition of Emily's capabilities from the medical establishment. It was validation that transcended military service and extended into her civilian career. Rodriguez finally found the words he had been struggling to express. "Ma'am, I need to ask you something. How do we change? How do we get better at recognizing what real capability looks like?" Emily considered his question seriously. "You start by listening more than you talk. You look for competence in unexpected places. And you remember that the best warriors often carry their battles quietly." Williams nodded, clearly taking her words to heart. "We've been trained to look for physical markers of fitness, but we missed everything that actually mattered." Emily's response was gentle but pointed. "Physical fitness is important, but it's not the only measure of a warrior's worth. Some of the toughest people I've served with would surprise you." Dr. Martinez excused himself to check on other patients, but not before once again expressing his gratitude for Emily's intervention. The impact of her actions continued to ripple through the hospital. Harold Morrison gathered his belongings, preparing to leave for his own appointment. Before he left, he turned to Rodriguez and Williams with a final observation. "You boys learned something valuable today," Harold said. "Don't forget it. The military needs people who can see past the surface." Rodriguez looked at his recruitment materials with new perspective. "We need to completely rethink our approach. Capability comes in many forms." Emily checked her watch, mindful of her commitment to her EMS shift. Her colleagues would be wondering about her delay, and she took her responsibilities seriously. Dr. Mitchell walked Emily toward the exit, their conversation continuing about the potential consultation arrangement. The professional relationship that had begun in crisis was evolving into something that could benefit both the hospital and Emily's continued service. As they passed the recruitment banner, Emily paused momentarily. Rodriguez and Williams watched her, waiting to see if she had any final words for them. Emily turned back to the recruiters with a thoughtful expression. "The teams need good people. People who can think under pressure, who put others first, who don't quit when things get difficult. Those qualities aren't always visible on the surface." Her words carried the authority of someone who had lived and worked within the elite military community they aspire to serve. This wasn't theoretical advice, but practical wisdom from the inside. Williams straightened his posture unconsciously. "How do we identify those qualities in candidates?" Emily's answer was simple but profound. "You ask better questions. You create situations that reveal character, not just physical ability. And you remember that the best operators often look like regular people until the moment they're needed." The lesson was clear and actionable. The recruiters had focused on appearances and assumptions rather than the deeper qualities that actually mattered in special operations. Emily walked toward the hospital exit, her limp returning to its normal prominence as the adrenaline completely faded. But something fundamental had changed in how everyone in that waiting room would view capability and service going forward. Dr. Mitchell accompanied her to the door, still processing the morning's events. "I have to admit, when I first saw you this morning, I never would have imagined you'd end up saving someone's life before lunch." Emily's response carried gentle humor. That's the thing about emergencies. They don't check your appearance before they happen. As they reached the exit, Emily turned back toward the waiting room one final time. Rodriguez and Williams were deep in conversation with Harold Morrison, clearly absorbing lessons that would reshape their understanding of military service. Rodriguez looked up and caught Emily's eye. He stood and approached her with obvious respect. "Ma'am, I promise you this conversation will change how we do our job. We won't make these mistakes again." Emily nodded approvingly. The military is stronger when it draws from the full spectrum of human capability. Don't let appearances limit your vision. Williams joined them, his earlier arrogance completely replaced by humility. "Is there anything else we should know? Any other advice for identifying real warriors?" Emily paused thoughtfully. "Look for people who serve others without seeking recognition. Watch how candidates treat people they think can't help them. Character reveals itself in small moments, not just dramatic ones." Her guidance was practical and profound, drawn from years of observing human behavior under the most challenging circumstances. These weren't textbook answers, but hard-earned wisdom. Dr. Mitchell's pager buzzed again, reminding her of waiting responsibilities. "Emily, I'll have those consultation paperwork ready by the end of the week. I hope you'll consider it seriously." Emily smiled genuinely. "I will. It would be an honor to continue serving here." The word "continue" was significant. Emily's service had never actually stopped, only changed form. From military medicine to civilian EMS to potential hospital consultation, her commitment to helping others remained constant. Harold Morrison approached for a final handshake. "Young lady, today was a reminder of why I'm proud to have served alongside people like you." Emily's response reflected the mutual respect that connected veterans across all service branches and eras. "The honor was mine, Mr. Morrison. Thank you for standing up when it mattered." As Emily stepped outside into the afternoon sun, she pulled out her phone to call her EMS supervisor. Her explanation would be simple. Medical emergency at the VA hospital, assisted with patient care, running late for shift. Rodriguez and Williams watched her leave through the glass doors. The woman they had dismissed as broken and incapable was heading to another job where she would continue saving lives and serving her community. Williams shook his head in amazement. "How do we get it so wrong?" Rodriguez looked at the recruitment materials in his hands with new understanding. "We were looking for what we expected instead of what was actually there. That changes today." Harold Morrison gathered his things, satisfied that the morning's lesson had been thoroughly learned. "Sometimes it takes a shock to the system to correct course," he observed. "Those boys just got the education they needed." Back in the emergency department, Dr. Patel was already incorporating Emily's diagnostic approach into his teaching with the residents. The case would become part of the hospital's educational curriculum, ensuring that Emily's contribution would continue helping patients long after she left. Dr. Martinez checked on the patient one more time, finding him stable and recovering well from surgery. The construction worker would return to his family because a woman with a limp had recognized what a room full of medical professionals had initially missed. Emily climbed into her personal vehicle, adjusting the seat to accommodate her injured leg. Her radio crackled with her supervisor's voice, asking for her ETA. She responded professionally, ready to transition into the next phase of her service day. As she drove toward the EMS station, Emily reflected on the morning's events. She felt satisfaction not from proving the recruiters wrong, but from the patient's successful outcome and the possibility that today's lesson might prevent future misjudgments. The VA hospital grew smaller in her rearview mirror, but the impact of the morning would continue rippling outward. Rodriguez and Williams would carry these lessons into their recruitment practices. Dr. Mitchell would implement new approaches to emergency medicine. Harold Morrison would tell this story to other veterans, spreading the message about looking beyond appearances. This story shows why we should never judge by appearances alone. Which moment hit you hardest? Share your thoughts below and let us know how this story resonated with your own experiences. Emily Chun continued toward her next shift, ready to serve wherever she was needed, carrying her capabilities quietly and deploying them when circumstances demanded. The measure of her worth had never been in others' recognition, but in her unwavering commitment to helping those who needed it most.